Hello everyone, this is Dr. Mansi from Homeopathy 360 and today we have Dr. Jineshwar with us with another topic and another webinar on Homeopathy 360 with BJ. I would like to give a short introduction about Dr. Jineshwar. He is currently Professor and HOD of Department of Anatomy from Gulabro Patel Homeopathic Medical College and Hospital, Miraj, Maharashtra, and India. Dr. Jineshwar sir, we welcome you all and we are very happy to have you as our speaker. Today I know our audience gonna learn so much from you and the topic is very interesting, which is from anatomy. Dr. Jineshwar is going to teach you from all of you. Dr. Jineshwar holds esteemed position of professor and HOD in Gulabra Patel Homeopathic Medical College, and his passion for the importance of anatomy in homeopathy education and clinical practice is very inspiring for the budding doctors and to social work for the society. He is practicing as a physician and homeopathic consultant at Sanjeevani Clinic in Malgaon, Miraj in Maharashtra. He is working as president of Malgaon Medical Association and he is a dedicated and enthusiastic homeopathic teacher and family physician to build the homeopathic society more strong. He is associated with various organizations and national and international associations. He has presented various webinars and publications. Various he has given various publications at national as well as international level also. He has also participated in free medical camps as well as a guest speaker on organ donation and body donation at Newton Homeopathic Medical College and Hospital. Dr. Jineshwar A. Yaligouda is working since 18 years as National Service Scheme Program officer involved in many social works and projects related to health and hygiene and health education and homeopathic treatment camps and mainly mother and child health programs. Dr. Jineshwar has done a lot of work for homeopathic fraternity and for students. Today, we are going to learn more important topics about anatomy, about thyroid gland, and lot more. Now, I would like to hand over the Homeopathy 360 webinar platform to Dr. Jineshwar. Please, sir.
Today we are going to study the one of the important the topic of anatomy, which is I am going to the thyroid gland. In this, you have to remember about the introduction to the anatomy. That is most important part is that it is one of the endocrine gland, which is we are going to study. And what are the endocrine and exocrine glands to remember? So one thing next, which is you have to remember about this is one of the important gland which is observed and clinically in the practice we are going to get the many disorders which are treated by the like medication by homeopathically as well as allopathic. But anatomy should be taught detail. Maybe the endocrinologist, maybe the super specialty in the homeopathy upcoming. So as you see in the thyroid gland is one of the it is a one when you can see this is appears like a seal like. It is a H shape and seal like which is appears, and this one which is thyroid, the word which is came from the shield like. So what general features of the thyroid and locations and weight of the thyroid gland. Capsules we are going to study, most important in relation to the, that is the prostate gland. Relations and all we are going to study. Then afterwards, the blood supply, lymphatic drainage, and nerve supply, structure and functions of the thyroid gland, and the clinical anatomy. So most important thing which is you have to remember, introduction of the thyroid gland. So in this first, which is a thyroid gland which is situated on the anterior part of the neck region, at the lower area part of the neck region. I have already told this thyroid gland is one of the endocrine gland, which is we are going to get the many hormones secreted that will be helping for the our psychic and somatic metabolism and basal metabolic rate. So this is all will be dealt in the anatomy of the thyroid gland. So first, most important thing is that is the introduction of the thyroid. So as we are studying in the total as we are network problem, please cooperate. So introduction in that I have told. Next part, which is I am talking about the related to the diameter measurements. This we have to see the almost all the each lobe is measuring total length is 5 centimeter and transverse diameter is 3 centimeter and diameter is 2 centimeter. Weight is 25 grams. In this, which is we are going to see the in the isthmus measurement, which is 1.2 centimeter into 1.2 centimeter. Diagrams, which is very well in this, you can see that is the most of the things theory paper that is requires for the your explanation. And this is a H-shaped thyroid gland, which is you can draw. And this is a which is a one which is a pyramid, the glandulae thyroidae. Fibrous band running from the hyoid bone to the that is a pyramidal lobe. And these are the parts where in the location of the thyroid and situation of the thyroid gland, it is cervical vertebrae, fifth, sixth, and seventh to the that is the thyroid cartilage, and to the up to the we are going to get the that is the you have to remember about the almost all the to the fourth or fifth tracheal ring. So this is a one thyroid cartilage you can see, and this is a hyoid bone, and this is a thyroid, which is a name itself. It is a shield like. So next, when it is a location, you can of thyroid is on the anterior aspect of the that is the we are going to get is a neck region, little lower and clasping the upper part of the trachea. And this upper part of the trachea is clasped by the thyroid gland. And it is which is the thyroid to the and fourth or fifth tracheal ring. Then the that is the external features of the thyroid. In this, as it one is the right and left lobe connected by the isthmus, and this is the pyramidal lobe, which is you can see. And this pyramidal lobe is connected by the levator glandulae thyroid. We have to see about after the measurement, we have to go for the, that is the next, about the capsule of the thyroid capsule. This is a comparison with the you have to remember about the that is the capsule of the prostate. You have to compare when you attend the surgery cases like a thyroidectomy and a prostatectomy. You have to remember the this one basic thing which is required. Surgeon is going to ask you surely in the OT question, that is the when thyroidectomy we do, you have to prevent the bleeding, so that that time you have to maintain the care of that. That is where it is we have the inner one is true capsule, outer is a false capsule. So that with the and we are going to get the that is the presence of the capsule, that is the capillaries in between the two layers. We are going to remove with the true capsule, that is the thyroidectomy. When we go the prostate, in that prostate, we are going to keep these two capsules behind to prevent the capillaries as we are going to get it. So this is the one which is the important thing, true capsule, and because these are the venous plexus, you can see that is there, and we are going to get the false capsule. And these are the venous plexus which may bleed, so that we are going to remove the true capsule with this, and during the are going to leave behind, because this is capillaries present in between the true and false capsule. The tissue is removed during the prostatectomy. Next, which is we are going as we are going to get that this is a thyroid section. In this, as I have told, the each lobe is having the apex and base, anterior border, posterior border, and anterior or lateral surface, medial surface, and this posterior lateral. There are three surfaces you can remember. Here we have the posterior lateral surface, and this is a medial surface, and this is the anterior or lateral surface. So my intention is that to tell you how to remember these relations accordingly to the remember about the that is the importance of the structure in the neck region. So in the neck region, what you have to remember, these are the anterolateral or anterior relation where we are going to get the muscles. Those we have the sternohyoid muscle, and this is muscle, anterior border of the sternocleidomastoid. I am talking about the relations of the thyroid gland. Or anteriorly by the sternohyoid, sternothyroid, and omohyoid, and anterior. Then when we go to the medially it is consisting related trachea and esophagus, external laryngeal nerve, internal laryngeal nerve. We are going to get the recurrent laryngeal nerve, two tubes, we can trachea and esophagus, and the inferior constrictor muscle of pharynx, as well as we have the those all will be relation to the medial and anterior and posterior. Related to the what? It related to the carotid sheath. Here what you are going to see, carotid, we have the internal jugular vein, and we have the vagus. Condensation of the fascia around the great vessels of the neck, that we are going to call as that is the carotid sheath. In this carotid sheath, you have to remember many things. That is a structure which are present in the carotid sheath. So this is the one important thing you have to remember. When we go to the relations of the in the isthmus, we are going to relate to the tracheal ring, second and third posteriorly. Anteriorly, it is relating to the, we are going to get the right and left sternothyroid, and we are going to get the sternohyoid muscles. These are relation to the anterior relation to the, we are going to get the isthmus. And posterior relation to the isthmus are, we are going to have the here tracheal ring, second and third tracheal ring are related to the posterior relations of thyroid lobes, thyroid gland, that is I am talking. Then I am talking about the isthmus. When we go to the most important part, that is the structure of the function of, you are going to, when you see under the microscope structure of the, that is the thyroid gland, it is having the two types of cells. We are going to get the follicular cells, which is the lines, follicular cells, which are in between the follicles. So these will be there for the, as follicular cells secretes the T3 and T4, triiodothyronine. Then we are going to have the parafollicular cell, that is a thyroid strip. We are going to get the thyrocalcitonin, which is the helps for the calcium metabolism. Cell secreting the thyrocalcitonin, and we are going to get the which are secretes the T3 and T4. In between this is a one material, slide material is seen here. That is, you can see thyroid gland. Very important here, you have to remember about the these thyroid follicles. You can see histology, the follicular and parafollicular cells. So this is the one which is a, we are studied the histology, or we are going to get the microanatomy of the, that is a thyroid gland. So almost all the things which are drawn here, you have to see these pictures should be clearly mentioned in the theory paper. So anatomy asked in this. As you see the functions in the thyroid, T3 and T4, you know, this will be helping for the basal metabolic rate, and we are going to get the psychic and somatic growth. In the parafollicular cells, which are secretes that is the thyrocalcitonin, that thyrocalcitonin, which is maintains the calcium, it removes the calcium from the blood and adding to the, that is the bones. So that here it is the reverse of the ferrous hormone, which is secreted. Then next going to the blood supply of the thyroid gland. Here we have to remember about the blood supply is by the, we are going to have and in thyroid artery. Superior and inferior thyroid artery. That is the one which is a superior thyroid artery, which is you are going to get. That is a branch of the, which is we are going to get the, you can see the artery and this the external carotid artery, which is you are going to see. And this will be given the superior thyroid artery. That is a, and all it is asked, that is the superior thyroid artery is a branch of the external carotid artery. Internal carotid artery does not give any branch. Then next you have to remember inferior thyroid artery, which is supplying here. This inferior thyroid artery is a branch of the thyrocervical trunk. Very important. Thyroid is very, in this you have to remember the blood supply of thyroid inferior artery. And this superior thyroid artery is a branch of external carotid artery and in of thyrocervical trunk. So this is the one which is you have to remember in the total in the blood supply of the thyroid gland. Then going to the venous drainage, the venous drainage of the thyroid gland is by mostly the, we are going to have the superior thyroid vein, which is we are going to get vein, and we are going to get the inferior thyroid vein. So we are going to have here, we all these superior thyroid vein and middle thyroid vein and inferior thyroid vein, they all are the blood, that is a venous drainage to the, that is the thyroid. Here, remember that is the internal jugular vein receiving all the veins from, that is blood, which is goes to the internal jugular vein. So that of the is by the, we are going to get the superior, middle and vein. When we go to the lymphatic drainage of the thyroid, in this you should know the deeper lymphatics pre-laryngeal nodes we are going to get mostly, and we are going to have the nodes along the recurrent laryngeal nerve, that is a pretracheal node. Pre-laryngeal nodes and pretracheal nodes which are there near to this, we are going to have the drainage, lymphatic drainage is by the draining directly to the, that is a cervical lymph nodes. So that the pre-laryngeal and we are going to recurrent tracheal nodes and jugulo-omoid node. All these are which are drains through the totally to the deep cervical lymph nodes. So this is about the lymphatic drainage of the thyroid gland. Then when you go to the that is the blood supply is by the blood supply and venous drainage, we are going to deal about the nerve supply of the thyroid gland. Here you have the one important nerves which are going nearby. Middle and inferior cervical sympathetic ganglion. These nerves which are supplying the inferior cervical sympathetic ganglion, these nerve supplies to the nerve supply to the thyroid gland. So very important in this, that is you have to remember about the, that is the one part which is a nerve supply. So it is a very important to know that these all are the MCQ question can be asked. That is the, what is the blood supply, supplying arteries, and short notes can be asked relating the blood supply of thyroid gland. And the MCQ question can be options, blood supply, venous drainage, lymphatic drainage, and we got the nerve supply of. So one which is we have to deal, that is about the before going to the clinical anatomy, just I wanted to tell about which is you should know about the that is the most important part relating the thyroid. You are the trachea and upper part of the trachea is clasped by the thyroid. That is the 25 grams of the weight we are going to get it. So this 25 grams of normal thyroid gland weight, this is also can be asked for that is the MCQ question. And the posterior border, which is we are going to get anterior border here, anterior border of the thyroid gland, posterior border, and posterior border of the thyroid, which are a small gland, that is a parathyroid gland. Posterior is gland on the posterior border, where the anastomosis of the superior inferior thyroid artery takes place. There will be, we are going to important thing, situation or location of the they are in 4 in number. Next, I wanted to tell this isthmus is having the anterior border and lower border. Here inferior border of the that is the isthmus, which is there. Here the inferior thyroid vein is leaves in relation, and the superior border, that is the anterior branch of the that is the superior thyroid artery, anastomosis occurs here. That is the relation. Anteriorly, we are going to have here skin and fascia, and we are going to get muscle, and posteriorly we are going to get the second and third tracheal ring. You have to remember about the isthmus. Then relations of the anterior border of the thyroid, where we are going to get the anterior branch of the superior thyroid artery, which is relates to the anterior border, and posterior border of the thyroid relates to the parathyroid gland. So this is a very important thing, which is you have to remember about the relations of the thyroid and all. Next, going to the to cover is that is the clinical anatomy of the thyroid gland. In this most important, how much is your thyroid in your body is actually, it is a distal phalange of your thumb. Distal phalange of your thumb is that the size we are going to get, as it is, you see the H shape or sealed like, and we are going to get that is below the thyroid cartilage situation. Then first clinical condition which you have to remember is that is as this is a one which is due to the deficiency of the iodine, which leads into a goiter. So what is a goiter? Goiter is the enlargement of the thyroid gland due to the deficiency of the iodine. So goiter means, don't tell that is the swelling of the thyroid or you get the so goiter is a one definition of the goiter is a it is the one, it is the enlargement of the thyroid gland due to the we are going to get that is by the that is a iodine deficiency. So that we provided to cover all these to control, that is iodized salt is made very micro milli, that is requires for the daily, so that it is provided in the salt. Everyone can daily required eating, and that is done iodized. So economic, every poor and rich people can eat, and everyone high salt and more economic, and daily we use little quantity, that is iodized. Any other product is not iodized. That is I'm talking here. It is a one which is cheap and daily required in less quantity, and that is a cheaper. Anyone can afford this, and more economic, so easily available, so that it is used for the iodized salt. So prevent this goiter. This goiter is common, mostly seen in the sub-Himalayan region. As the water content of this will be the salt of iodine is less, so that they may suffer of this north of India, having the more cases of the goiter. In the coastal region, very less. That is, if the person are having the seafood and all, that time it may be the preventing the one factor. So that to prevent the Indian government iodine provide, and that is compulsory to have, and that is most of the goiter cases are reduced. So next, which is we study in the second one is hyperthyroidism. So in this hyperthyroidism, as we have the either excessive secretion or less secretion. So excessive secretion, which leads into a that is causing the hyperthyroidism. That may represents like a symptoms like a tachycardia, tremors, and increased BMR. As this gland is a basal metabolic rate related, the thing which is we can see these signs and symptoms which is relates to the that is a hyperthyroidism. Then next going to the hypothyroidism, that is after the goiter and hyperthyroidism, if there is a secretion of the thyroid hormone becomes less, of the myxedema in adult and cretinism in children. These are the two conditions where we can see in the children's as well as we have in the adults. One condition, clinical condition, we call as a myxedema. That is the one which is you have to remember. So that what is most important here? That is a goiter. First I have told. Second I have told the that is thyroidism. Second, third I have told the hypothyroidism. So this is the one which is you have to remember in the that is a thyroid gland. The next applied anatomy is gland. This malignant growth can be tumors of the thyroid, or we get the nodular goiter, or we have the malignant that is growth can be takes place in the thyroid gland. So that condition we call as a malignant growth of the thyroid gland. Then if the goiter is increased or more swelling goes on, increases, then we have the pressure symptoms. There is a compression on this dyspnea, we call it the dyspnea. If compressed aphasia, we are going to call it may neighboring structures of the neck region. They may be the compressed by the if the enlargement of thyroid takes place. So that we have come across these all heads under heads, we have studied the thyroid gland. So one thing I wanted to highlight for the anatomy study people or who study, you have to know the most important part is the what is the external feature and what are the conditions where clinical conditions you are going to goiter. In this goiter, most of the things which is you are going to see in the clinical condition, you have to understand this one in the goiter condition and all. What to do? In the first year anatomy students can make the or can study the what is the introduction of the thyroid gland, what is the external features, as this is a bilobe structure which is you have to remember, two borders, anterior border, posterior border, medial and anterior and posterior lateral, three surfaces. Isthmus has an anterior surface, posterior surface, upper border and lower border. These external features you should know. Then most important is the relations. In this relation, commonly you have to practice. This is the one which is the neck region transverse section where you can see the trachea and esophagus, and this is the carotid sheath or the great vessels of the neck. And our anterior triangles neck, which is having the triangles muscles, and those are forming here the relations to the that important part which is you can remember. As I have told the measurement and all you have to remember. In this measurements and all, so in this most important, each lobe we are getting the measurement 5 centimeter and 3 centimeter and 2 centimeter. That is the length and transverse diameter, anterior posterior diameter of the each lobe of the thyroid is 2 centimeter. And weight will be 25 gram, most important. Isthmus measures about the 1.2 cents. So with this, and lastly, you have to remember the blood supply of the thyroid gland. Then in that, you have to know the superior thyroid artery and inferior thyroid artery. That is the most important, which branch they are. External carotid branch is the superior thyroid. Thyrocervical trunk branch is we have the inferior thyroid artery. So this is the one which is you have to remember in the total about the thyroid. And I have told already what is your thyroid, how much your thumb. So what is a function here? As this thyroid gland is secreting the T3 and T4, you have to remember triiodothyronine, tetraiodothyroxine, and we have a. So this and T4 helps for the psychic and somatic growth and basal metabolic rate. Then we have the thyrocalcitonin, which is maintains the calcium metabolism. Whenever there is a blood calcium level that is a 10 milligram percent, if it is reaches higher side from the blood calcium, that is removes the calcium from the blood and adds of the parathormone, that is a parathyroid gland. So this is in generally you have to remember about the functions of the thyroid gland. So clinical application, you have done hyperthyroidism, hypothyroidism, what is a goiter, goiter definition you have to remember. Then then thyroid we are going to remove surgically, that is a under surgery, that is a thyroidectomy. We call as a surgical removal of thyroid gland, thyroidectomy. So these all things you should know in the, that is a clinical anatomy of the thyroid gland. Important things I have covered today in this lecture. That is one thing, that is first I have told the introduction of the gland, size and location and measurements. Then I have told the external features, relations. Then I have told the structure and function. Then I have covered the almost all the part which is blood supply, venous drainage, lymphatic drainage, and nerve supply. Then lastly, I was told about the, that is the clinical anatomy of thyroid gland, goiter, hyperthyroidism, edema, cretinism, malignant growth, and pressure symptoms of the thyroid and thyroid gland. So when we have the less calcium in the blood, that is suffering, that is opposite action of the thyroid hormone, that is a parathormone. To get the when low blood calcium level there, then condition we call as a. This is all anatomy of thyroid gland. Then homeopathically, you have to remember about the what is thyroid is relates. Homeopathically, homeopathic when students should know the how to apply clinically this knowledge of thyroid in relation. As you know the thyroid anatomy, our great masters of inventors and father of homeopathy, Dr. Hahnemann, has given the great acting medicines you can treat in your OPDs. Thyroid cases, these clinical condition. If you have studied these clinical condition properly, then only one which is making the study. So that with this, I have covered my topic so that it is very much to share on the platform of Homeopathy 360, that is teachers beyond the boundaries and teaching, that is anatomy to the all. Is the one who I am very much thankful to the moderator, Dr. Rishi Prakash, madam, and the coordinator, Dr. Mansi Tyagi, madam, where very nicely they have done the coordination. So this is a very much thankful to you, and B. Jain, the publishers, I am very much thankful to you. Thank you very much.
Thank you so much, sir, for this wonderful presentation. And the session was full of information. And I hope
Yeah.
all the attendees have enjoyed this session.
Okay, madam. Thank you. Thank you very much.